neutral on, thank you for whoever hit record, I appreciate that. For everyone who, for those of us who got questions about it, we felt like we needed to do a presentation on it. I think this is something that SWARE in our grassroots movement has always done very, very well. We illuminate issues that sometimes don't get brought to light, because I think when someone is pro a bill, sometimes they can miss the inequities that are there because they really want a bill to pass. And I think we learned that very well last legislative session. And so I think something that we really wanted to make sure we did was present all the information that we have, partner with stakeholders who are involved in this bill if they could come to answer some very real questions that some social workers do have about the compact, and may not have been answered when we heard testimony for it in the HGO hearing. But before we get into all of that, before I get into the ground rules and like guidelines and who we are, I'm going to kick it off to Maria, and she's going to lead us in a brief grounding practice for this evening.
Oh, okay. Thank you, everybody, for being here. My name is Maria, and I'm a member of SWARE. And I just wanted to offer just a couple moments for us to arrive. And this can look like folks were running to get here. If you still need to get some water, some food, use the restroom, I invite you to do so. Oftentimes, as social workers, we're running to get from place to place. And so I just wanted to offer an opportunity to check in with our bodies, notice what's here, how we're feeling about coming into this time tonight. And again, invite folks to be with any needs, going to the bathroom, getting food, water, as we go through. The first part of the presentation is mostly just listening. So if you want to join me in just taking a couple deep breaths, noticing what might be beneath you, supporting you, underneath your feet, your back, your body. Noticing if there's any stretch, if there's any kind of movement that wants to take place. And giving yourself permission to breathe and to notice what's coming up in your body as we go throughout this presentation today. We're here to be a support. So if anybody needs anything, feel free to reach out and let us know. And with that, I will turn it over to Felicia.
All right, and we're back. So again, for those folk who just came in, welcome. Feel free to share who you are in the chat. Again, we are asking everyone, so that we can be as accessible as possible to deaf and hard of hearing communities, to turn their video off and mute themselves, so that everyone can have an ease of following the presentation. So let's get into it. So the primary focus of today is Maryland HB0034, SB0204. I never know how to pronounce them, so I just say them full out like that. They are cross-filed bills in the Maryland General Assembly, and if signed into law, they would allow Maryland to join the Interstate Social Work Compact. A bit about us. SWEAR, which stands for Social Workers for Equity and Anti-Racism, is a collective of Maryland social workers who came together to illuminate the biased practices of the ASWB and highlight the inequities of the current path to licensure. That is our origination, and since then we have formulated and grown into a grassroots movement that is illuminating all inequities that we see in Maryland social work, regardless of if the ASWB is involved. Over 380 plus Maryland social workers and community members are connected to our movement, SWEAR. So I want to review guidelines. This is one of my favorite quotes, Happy Black History Month. We can disagree and still love each other unless your disagreement is rooted in my oppression and denial of my humanity and right to exist. SWEAR is focused on centering those most marginalized within society and within our profession. So please be aware of how your comments impact those most marginalized by society and by our profession. I can guarantee you, if it's not me, somebody will call you in about it. Participants will be muted during our presentation. Please share questions and comments in the chat. We do have moderators that are going to make sure that all questions and comments get counted so that when we get to the open discussion portion, we can revisit that. Open discussion will take place after the presentation. Please keep comments and questions respectful. We will call you in if they are not. Okay. This is our agenda for this evening, an overview of the work group and the compact bills. We're going to have the Deaf and Hard of Hearing experience led by Dr. Judy Mounty. We're so grateful to have her here. And then we're going to go into our open discussion about the Interstate Compact's impact on social workers from marginalized or underrepresented communities. And then we'll say our thank yous and then our farewells. Let's get into it. So this is a timeline of the Social Work Compact plus the ASWB timeline. So as you can see, in July 2022, the Interstate Compact was introduced by the Council on State Government, Department of Defense, and the ASWB. And then in August of 2022, we had the ASWB exam pass rate analysis release, in which we found out about the biased data. And then in February 2023, we now have the Interstate Compact, which was finalized by the Council on State Government, Department of Defense, and the ASWB. So from the CSG website, a social worker using the Social Work Licensure Compact to practice in any compact member state must abide by laws, regulations, and scope of practice of the state in which the client is located. As currently drafted, Section 4 of the Compact requires licensees pass a qualifying national exam. And currently, the only national licensing examination is produced and administered by the Association of Social Work Boards. To be eligible to use the Compact, social workers must have passed the ASWB exam corresponding to the category of license sought. From the Social Work Compact website, no substantiative changes should be made to the model language. Any substantiative changes may jeopardize the enacting state's participation in the compact. So currently, as you can see from the map, this is the Social Work Compact plus the ASWB exams requirements. So this shows that there's legislation pending in these states in light blue, and that legislation has been enacted in these two states. There is no LMSW exam in California, Florida, Illinois, Massachusetts, Michigan, Nebraska, New Hampshire, Rhode Island, Utah, Washington, or Wyoming. Now I want to talk about the work group. So in April 2023, SB 871 passed with heavy redactions. The work group was formed with robust representation. October 24th, 2023 is when we had the first work group meeting. We were supposed to get deadlines, but we missed those deadlines because of the delay. And in April or May of 2024 is now when we're supposed to get those recommendations to be sent in. And right now, subcommittees have been formed and are meeting bi-weekly, and the larger group meets once a month that the public can view. The work group was formed to address the issues regarding the inequities in the ASWB exam pass-fail rates for marginalized social workers, which was confirmed in the data release. And the report deadlines that were due on September 2023 and December 2023 didn't happen because of the delay. There are 4 subcommittees: policy, testing barriers, testing recommendations, and then we have our deans from the universities coming together and meeting as well as a subgroup. So currently, we have the Maryland Department of Health Work Group on Social Work Requirements for Licensure. There are 23 members. We do have 1 vacancy. We have had 6 meetings and we have 4 subcommittees. Our next meeting is on Tuesday, February 27th, from 10 a.m. to 12 p.m. The public can come in, they can comment, they can view. So we do encourage you guys to come in and comment and view. I am on the work group. I'm the NAACP appointee for the work group. So the work group is supposed to identify potential alternatives to the current examination and licensure process and make recommendations on how to implement potential alternatives in order to reduce barriers and bias. And so now I'm going to hand it over to Mike, and Mike is going to explain how the compact and the work group are intersected.
Okay, hi everybody. Yes, my name is Mike Massey, and use he, him, his pronouns, and I'm an assistant professor at Catholic University, professor of social work, and a resident of Maryland. So I'm going to try to just briefly give an overview of what is the compact, just to make sure we're all on the same page about what this means, what this current legislation would do. And then I'm going to, again, briefly just talk about, why we think it's important to consider the connection between the work group that was created in the legislative session, the previous legislative session, and what's happening now with the compact, because there are some things to think about. So before I get into what's the compact, just a couple things about the work group as well. So last year, just as a reminder, last legislative session, there was a bill that was proposed that was essentially responding to the data that was released that's showing sort of the just alarming racial and other disparities in the exam pass rates. The bill, if passed, that was fully written, would have eliminated the use of the bachelor's and the bachelor's exams, and started to look at alternatives for the clinical exam. And but what the General Assembly decided to do was, rather than rush in, despite some overwhelming evidence, they didn't want to rush in because they were just learning about it. And they said, let's form this work group to explore these issues about the exam and look at alternatives that would be more fair and equitable. So the work group, as Felicia said, was put together. It's a diverse work group, and is really taking the work seriously and doing a great job, though they got started late. So now there's legislation here that's looking at having Maryland approve and join into this interstate compact. So I wanted to just briefly talk about what that is. So basically, the Social Work Licensure Compact is an interstate occupational licensure compact that basically would allow for licensed social workers to be granted a multi-state license that authorizes practice in all other compact member states. So in other words, it allows for transportability of a license across state lines. Right now, if you go practice in one state, then move to another one, you're not licensed in that state. You have to apply for a license. Oftentimes you have to, there's different requirements, and it's a hassle. It's also difficult to work, or impossible often, to work with clients from other states that you're in. So there's a lot of potential benefits that passing this compact could offer. Right now, the compact is not officially a thing right now. It needs at least 7 states to pass legislation to join the compact before it can actually be enacted. So we just saw there's 2 states that have passed it. So, and there's lots of states right now where there's legislation being considered. It seems fairly likely that after this, the legislative sessions of this year, that we'll probably get to that 7-state threshold and the compact will then become enacted. So if Maryland does pass the bill to join the compact, it's likely that the compact will become a thing, fairly quickly. But if they don't, they can always reconsider that legislation in the future legislative sessions. Now, can you go back one sec? To a couple other things. To qualify for a multi-state license, social workers who then live in a compact state, if they're in a member state, they have to be eligible for a license in their state and also meet the compact license requirements. So this is important, and I'll explain why in a second. And if you want more detailed information about the compact, if you go to swcompact.org, there's lots of really good information on what it is. Okay. So why is this relevant to the work group? Well, again, as Felicia said, the work group is really doing a lot of work to look at data and alternatives to the current examination and licensure process. They're digging very deep into the impacts of the current licensure process and what it would mean to have alternatives. And the compact is very much tied to an exam right now. So a few things to remember. The compact was done at ASWB, who are the people that make and sell and make a lot of money from the exams, were a key contributor to the compact structure. And in fact, it was in their interest to build in language that required a qualifying national exam. The original language was just a qualifying national exam. After the data was released, there was language added that also included substantially equivalent assessment. So the compact does leave room for the potential of an alternative to the ASWB exam to be considered. The problem right now is that there's no equivalent that is currently accepted anywhere. And what would have to happen is that the compact members would then have to approve of an equivalent assessment that would work for the compact. So our contention is that if the compact is approved before the work group recommendations are made, it could potentially complicate how the General Assembly responds to the recommendations. And I want to give a specific example, which will be on the next slide. So on the swcompact.org, one of the things they say is that if a state does not require the multi-state license applicant to pass a qualifying national exam, licensees in that state may take the ASWB exam and petition the state board on an individual basis, but that state is under no obligation to process that application and issue the multi-state license. So there's a scenario to think about here. So let's just say, for instance, that the work group does their work and they come back with the recommendations that yes, Maryland should eliminate the bachelor's and master's exams as a requirement for licensure. And that would be the fair thing to do. And it would, and I'm not saying that that's going to happen, but that's one of the possibilities that they're considering. Let's say that that does happen. And we've already passed the compact. Well, that creates some issues. What that means is that Maryland social workers could be licensed without an exam. but then they would not be able to apply for the multi-state license. And so if you wanted to apply for the multi-state license, then you'd have to take the exam because there's no alternative now that's accepted, and then apply separately for that multi-state license to the board. So that creates some real administrative challenges. It creates a kind of two sets of licenses in Maryland, which is an issue that people brought up last year during the session. And so that may create opposition or challenges to what the work group recommends, because it does create some administrative challenges in different areas. So I think what we want to consider is, do we have to rush through the compact process? Maybe it would be, it's possible that that undermines the work of the work group. And we want to make sure the work group is allowed to do their work, but possibly before we consider some of the implications of the compact. So that's all I'll say now. I wanted to set that up for us to think about the connections between the two. And then when we have discussion later on, we can answer any questions, or if I wasn't clear on any of that, I can try to clear up any of those issues.
This is Felicia. Thank you, Mike. I'm going to invite Maria to come up. She is going to go over the timeline of the compact and where we are up to currently.
Thank you, Felicia. I have just a brief section here. So to kind of, for those who aren't aware, I think many might be aware if you're here tonight, but there's two cross-filed bills in the Maryland General Assembly right now, House Bill 34 and Senate Bill 0204 or 204. And these bills were pre-filed back in October, and the bills are being sponsored by Delegate Kerr of the Health and Government Operations Committee in the House, and by Senator Benson in the Senate. The bills were assigned to the Health and Government, sorry, my apologies, I'm getting ahead of myself. November 2nd, there was a hearing in front of the Health and Government Operations Committee. Sorry, February 2nd. And House Bill 34 has now been assigned to the Health, Occupations, and Long-Term Care Subcommittee that has not yet met to review the bill, but should be meeting in the next week or so. The cross-file bill, Senate Bill 204, has a hearing in the Finance Committee next week, next Tuesday, and the written and oral testimony will be due a day before. So that will, the written and oral testimony for the cross-filed Senate bill will be due on February 12th between 8 and 6 p.m. And we strongly encourage folks who have opinions, perspectives, to share their oral or written testimony. From kind of viewing the hearing, NESW Maryland, we have some folks here from NESW Maryland provided oral testimony in the House hearing, as well as the Greater Washington Society for Clinical Social Work. And the Council on State Governments also provided oral testimony, the Department of Defense, Maryland Military Coalition, along with a few local therapists. What I thought was interesting is there wasn't a lot of racial diversity just on presentation in the oral hearings, in the oral testimonies. The written testimony, I believe, is not publicly available yet, but if the bill kind of moves on to the next round, it would eventually, we'd be able to read over who submitted written testimony and what their perspectives and opinions were. So again, just a reminder, next Tuesday is the Senate bill hearing. And hopefully, as part of this discussion tonight, we are able to call forth some nuanced perspectives and really look at these bills in a critical lens in a way that maybe did not occur at the House hearing.
This
Thank
is
you.
Felicia. Thank you. So, thank you, Maria, and thank you for calling in the fact that at the testimony we didn't see a lot of racial diversity. I think that that's important. I also noticed that the Association for Black Social Workers were not represented. I don't know if they knew about the bill, but I do want to call that in because I know when it came to the licensure legislation, they also were not called in about that. And I think that that's so important to have all voices at the table. Moving right along, now is time for our presentation from Dr. Judy Mounty.
Thank you so much for the opportunity to share with you today. So I have been trying to address the issue of licensure for deaf people in getting social work degrees for many, many, many years at this point. It's really heartbreaking. It's a heartbreaking situation. There are so many knowledgeable and skilled, competent deaf people who have social work degrees who cannot pass the licensure exam. So there's a great need for deaf providers in our field. And not just, here, but all over. I mean, in Maryland and the rest of the country as well, there's a dearth of signing professionals. I have the license, but I have many colleagues that I coordinate with, several groups of practice, communities of practice of deaf and hard of hearing community members really around the country. And there are excellent groups practicing primarily virtually. And they have counselors and social workers, psychologists, other sorts of helping professions. And those who, there are few who have licenses and many who are not, who are working under supervision only. And those people have to get the multi-state license. So I'm only licensed in DC and Maryland. And so I have to turn down clients who, are requesting virtual therapy from other states. And I work with people who have tried to pass the licensure exam and have tried to provide support, tutoring, what have you. And the problem seems to be primarily the test itself. Deaf people have a different experience with English, and many are very strongly bilingual in both American Sign Language and English, but the language of standardized testing is unique. It's a unique way of using English. And because of that, it's not the same as what an English user is used to in a novel or a newspaper or other kinds of places where high-level English can be used. It's still a unique format of English in standardized testing, and that's a barrier. Of course, I'm thrilled to be able to provide services, and I was looking forward to a compact kind of idea being established so then I could provide services to a broader swath of the deaf and hard of hearing community across the country. However, I'm also a member of SWARE, and I'm on the Maryland working group. And I realized that if we are to join the compact before we've actually figured out how to address the inequities that are inherent in the testing system, we may not actually be able to achieve the goals that were set out. I would like to believe that if we pass the bill and we join the compact, that once we're maybe inside the compact, there would still be an opportunity to work towards increasing equity and equitable access. But I can't guarantee that that would happen. And so I'm very strongly conflicted. So that's kind of a brief summary, and I'm very happy to answer questions if there are any.
Felicia here. Let me add a pin. Oh wait, then I'll try to spotlight. I don't want to mess you guys up. Okay. Does anyone particularly have any questions for Dr. Mounty before we move on? I want to make sure that if there are particular questions for her, that she can answer them. No? Okay. Thank you, Dr. Mounty.
Thank you. You're welcome.
Okay. So now we're at the portion of our Q&A and open discussion. We really brought this town hall together because we wanted to highlight some of the inequities and the potential impact on social workers who are part of marginalized communities, but also the communities that they probably primarily serve. So please raise your hand if you have a question or comment or insight. We have folks, I may not be able to see you, but I'm going to depend on the chat and my moderators to tell me who's first, second, third, etc. And so that we can make sure that this is accessible, please wait to be pinned so that the interpreter can follow you from the moment that you start talking. Okay. So does anyone have any comment, questions that they'd like to discuss? After all, we have reached the end of our presentation. I'm reading the chat. Dr. McCullen gave Dr. Mounty a compliment, saying that she gave an excellent presentation at the last meeting of the work group regarding deaf and hard of hearing communities and the exam. It was very educational and helpful. She said, thank you. Okay. So if no one wants to come off of mute, that is fine, because we compiled questions and comments.
I have a
Oh,
question. Excuse me, Felicia. I have a question.
hi. Okay, hi. Let me
All right, this is Bobby.
find you and pin you real quick. Give me a minute, brother Bobby. If one of my co-hosts find him before I do, can you please pin him? I'm coming. Oh, let me pin. Found you. Give me one. All right. And are you still spotlighted, Sarah? We good to go? Okay. Okay. Go ahead, brother Bobby. Oops.
Forgive me if I'm being redundant. I just wanted to be clear. It may have was already said in your presentation. But for the multi-state licensure, is the Maryland General Assembly possibly pushing to include the ASWB exam as a part of the bill. Correct me if I'm wrong. I'm just trying to get clarity on that.
No, you are correct. So, in order, and anyone, Mike, do you want to hop in here?
Sure. Yeah, if you don't mind, and I'm happy for people to add into it. So the Maryland, basically the law would be to accept the language of the compact as it is. And so the Maryland's not adding, doesn't have the authority to say only the ASW exam in terms of the contact. Now they could have the authority to say that's the only one we'll accept for our licensure, but that's different than the compact. What the compact says is that it requires that someone with the multi-state license have to pass a national qualifying exam at whatever level they're applying for a license for. So that's either bachelor's, master's, or clinical. And so currently, right now, that the only recognized national qualifying exam is that ASWB exam. Now it does have language that allows for an acceptable kind of substitute. But that's where there's a little bit of a struggle, because right now there's no known substitute. And what would happen, just for further clarification, what would happen is once 7 or more states approve of the compact, then their members of their boards then become part of basically a committee that would make decisions on kind of a compact board. A commission is what it would be called, right? And then they have the discretion then to decide on what alternatives might be acceptable. So that's kind of down the road. It does open the possibility that alternatives could be accepted. The issue now is that right now ASWB is the only game in town, and so there is a concern that passing the compact now sort of further entrenches the exam for the time being. Anyway, I hope that answers the question.
Yes, thank you.
Thank you. Thank you, Brother Bobby, for being here. I hope I don't call you out too much, but Brother Bobby, last I knew, leads the Baltimore chapter of the Association for Black Social Workers. So I'm really excited to have him here, because I think oftentimes we don't get to hear their perspective enough or his voice enough. So thank you for being here, Brother Bobby. Okay, so I see a question in the chat, a couple questions and comments in the chat, and then I see Ellen's hand. So Ellen, I'm gonna get to you. I just want to get to the questions in the chat first, since I saw them first. Dawn Schaefer, hey Dawn, asked, what are the states that have done away with or rejected the exam requirement planning to do about the Interstate Compact?
Yeah, that is a good question, Felicia. My assumption is that they will. So let's take, for instance, Illinois. That's kind of the most prominent case here, that fairly recently eliminated the master's and bachelor's level exams for licensure. My assumption is they will maintain that. So you can still get licensed in Illinois to practice in Illinois at the master's and bachelor's level without taking the exam. And now they've actually also developed an alternative process to get your clinical license as well. I think that will remain the same. However, if Illinois then becomes a member of the compact, anyone that wanted to get a multi-state license within Illinois currently would then have to take the ASWB exam. And then if they pass that, then they'd have to then apply back to the board of Illinois to be approved for multi-state licensure. And right now, that's the Illinois doesn't even have to accept that. It's at their discretion. That's where this gets a little bit rocky and confusing and creates some administrative confusion. But, you know, it's still possible. You know, the pathway is there, and I think it's probably a better alternative than not having that. So in other words, the people who are licensed in Illinois, if they join in this scenario, that didn't take the exam or didn't pass the exam could still practice in Illinois, but they wouldn't be able to get approved for the multi-state licensure and have the portability.
And I think what I'll add, Mike, this is Felicia, is that the Interstate Social Work Licensure Compact is an opt-in. So it really does create almost this another tier of licensure. You can opt into it. You do have to pay a fee. It is a different level of licensure from what I understood from the testimony shared. Yeah.
And I just want to add that Rachel points out, I just used the Illinois as a hypothetical example. They don't have any pending legislation to join the compact at this point. So just thank you for clarifying that.
Ellen, if you wanted to come off of mute or come off of video and share.
Can you see me? Hi, everybody. So I'm a little confused because I feel like we're putting the cart before the horse. If we are still working in the state of Maryland to decide if we're even accepting the ASWB exam, how can we be talking about the interstate compact? Because if they're using the ASWB exam, but we may not be accepting it in Maryland with the work group, I'm very confused about what comes first and second.
No, that's why we're having the town hall.
Yeah, it doesn't make any sense because don't we have to finish that work first? And then I don't know who brought up the compact and why that's even on the table at the moment.
So from my knowledge, I believe that the compact, and I may be wrong about this, anyone can jump in and correct me, was introduced by Ann Ciot. Is that their name? I believe from the NASW. I don't know if I have that completely correct. But I do know that the compact was introduced before the pass rate data release from the ASWB. So this has been something that had been in the works even prior to us finding out, I think, what all of us been knew about the ASWB. So I will say that. And okay, I'm chatting and managing. So I do see Scott's hand. So please go ahead, Scott.
Hey everybody, thanks for putting this town hall together. I think it's really, really helpful. In a prior career of mine, I was a lobbyist for the Maryland Nursing Association, and I think just want to highlight that there have been other professions that have kind of gone through this question. It's not unique to social work. About whether or not we should pursue compacts, even though our preferred state law doesn't align exactly with the compact. So for example, the nursing compact, the RN compact, requires you to have a social security number in order to participate in the compact. Maryland nursing law does not require that. And so, if you're a Maryland nurse who has not a social security number, you can still get licensed in Maryland. And if you have a social security number, you can get a compact license. So I think it's just important to think about, there is goals and things we should be pushing for as a Maryland license. But in order to make a compact work, it kind of has to be the lowest common denominator, so to speak, between every state in order to make it function. So, I think looking at some of these other compacts might be illustrative to folks about, just looking at, the goal. I don't think the goal is ever perfectly match our state law with any compact, because honestly, it's just not possible. So mostly just flagging that, other professions have worked through these questions, and I think have come to some pretty good, interesting solutions.
Thank you, Scott, and thank you for being here. One thing that I thought about as Scott was speaking, from a perspective of someone who's been harmed by the ASWB and by the licensure process and by the board's process in many ways, I think that this is more about, for some people, this is less about us having to just kind of compromise and more about what we're compromising about and for. I do think that there's going to be discomfort with any legislation. I think that is just the way that our system is set up. However, this system and what social work is about and has been about has been so linked to values and morals that I don't necessarily know if the field has been upholding when it comes to the way that we get licensed, and not just in the state of Maryland, but nationally. This is a national issue for social workers about the way that we've been getting licensed and who's been left out of rooms and who isn't able to make those decisions. And I think a lot of times that gets missed. And honestly, that's the whole reason why SWARE has come together and has formed. So I just wanted to say that. Dr. McCullen, I see that you wanted to say something. You can come off of mute and you can go ahead.
Hi. A thought occurred to me as I've been listening to this, and from my recent experience, being at the Board of Social Work Examiners, which meant I attended a lot of things, trainings and things that ASWB was putting on. One of the arguments that we've been making for doing the compact now, we meaning an ASW, I'm not representing anybody except myself as a retiree, but I attended these meetings. One of the arguments that's been being made has been, if you are one of the first 7 states that approves the compact, then you get to be on this group that puts together all the rules about how this happens. I suspect that those states that are passing it are going to have someone from their Board of Social Work Examiners as the person who serves on that group of people who puts this together. I don't know for sure, but I just have an idea that that may be how that group is formed. And I was thinking another way that that SWARE might be involved in this would be to say, hey, we might be interested in passing the compact in Maryland if it would mean that we could have a say in who would be serving on that group from Maryland. So for example, if Maryland was one of the first 7 states that passed the compact and then got to be on this commission that puts together the rules, instead of it being someone from the Board of Social Work Examiners that automatically served on that it was, somebody else who might have a different kind of opinion than, that sort of group of people. That's just a thought that occurred to me as I was listening to this discussion today because I just wonder, who those people are going to be who are on that commission. How does that get decided? If each state who's on there gets to have one person on this commission, who gets to decide who that person is? And so I was wondering if that would be something that the legislature could say something about. Well, yeah, we would approve this compact with the condition that, the person from Maryland serving on that commission would be this kind of a person. So anyway, it's just a thought that came into my head. I should be careful about what I say when thoughts just fly into my head, but I thought I'd share it here.
No, thank you, Dr. McClellan. That was helpful, and I appreciate that. Maria had a question around what happens if most of the states who join are more conservative than Maryland. And I think that also gets into thinking about what are the ethical implications if those state laws are against our ethics and values as it relates to queer and trans gender affirming care, etc. And I don't have an answer for that because I actually have the same question. So yeah, Mike, did you have a response to Maria's question?
Cheryl's also got her hand up.
No, I'm just seeing that. Thank you.
Yeah, I can wait. Why don't we hear
Okay.
from Cheryl?
Hi, Cheryl. Sorry.
Oh, hello. I'm not on camera because it's been a long day. But I'm glad to be here. I'm Cheryl Taylor. I'm in Montgomery County, Maryland. And after many years of community mental health, I am in private practice. And so I'm new here, but I just wondered whether you all or we are looking at or researching or talking to like the American Psychological Association or the LCPCs who are ahead of us in this game to see kind of what their process has been. And so that I know that the APA is really powerful and really resourced, but I just wonder kind of, has there been a look at their process around the interstate compact?
So I know on the work group, we've looked at their process as it relates to licensure because their licensure process is not as complex as ours. But I don't know if LCPCs have the same issues as it relates to their licensure process as it relates to like the pass rate and identified like information as it relates to the exam as we do. So I do not know how much research has gone on in terms of the compact. I know that we have been doing active research as it relates to the way that we get licensed overall compared to them.
Okay, thank you.
Mike?
Okay, this is Mike. Do I need to be pinned or am I already pinned? Am I okay to go?
Yes, you're pinned.
Okay. Okay, a couple things. So Rachel, this is Dr. McClellan, I think brought up a good point, but I think I'm going to put, so Rachel pointed out that the compact language, that the members of the commission are, they have to be part of the state board members. So I'm going to put in the chat the language that says that, so we all kind of see who would be the members of the commission. So I'm putting that in the chat now. I also wanted to kind of clarify a couple things from questions that have been asked, if I can. So it is possible that if Maryland joined the compact, quickly this session, right? It is still possible that Maryland, and this was a point that was made earlier, Maryland can still have a different requirement than the compact does for how it licenses its own social workers. Okay, so that's still possible. And so passing the compact does not mean that necessarily that we wouldn't be able to, license social workers differently in Maryland after that. The issues that come up for me are a couple things. First of all, last session, we brought overwhelming evidence to the General Assembly about the harm that was being caused by the exams to multiple different communities and populations of social workers. And in Maryland, we brought evidence that it would add to the social work workforce without doing harm. We brought a very strong case. They listened, but in the end, they said, we don't want to rush into this. We need to learn more. We need to take our time. And so they didn't take any strong action that could have led to greater equity and greater participation in social work. But they did approve of this work group that we have. That's a diverse group of highly skilled people that are working really hard to learn more and give an informed decision. So my question here is, if they didn't want to rush into something then, why would we want to rush into something now before we've given that work group a chance to fully look into it? And so I know that I testified, or I sent in testimony that said, I'm asking, this is my personal recommendation, is that they put this issue of the compact to the work group to consider along with their other tasks, so that Maryland can make an informed decision on the compact as well as its own licensing procedures. So it goes back to this cart before the horse thing. And I do, people are claiming that they're not, that the compact and the exam are separate issues. But I think what we've raised tonight is they're not. There's overlapping issues. And so, my concern, as and I think is the same as Swear's general concern, is that the work group is really looking how to make this a more fair, equitable, and less harmful process. And why don't we let them do the work, before we rush into another decision.
Thank you, Mike. Scott?
I had a general question, I guess, for the group that maybe is, rhetorical, but more just, something I've been thinking about. I think I agree the exam needs to go. I guess, my question, to Mike's question is, do we, I think there is general consensus growing in Maryland that the exam should go at a minimum for the LPSW and the LSW. I personally have similar beliefs about the clinical exam. I think as most people do. I think it should probably also go away. But I think there's general consensus on those first two exams. But I guess my question is, do we actually think that there is generalized consensus across the nation that those exams should go away and that the compact will change in any near future? Because I guess my question is, are there access issues that could be addressed by the compact? Our clients and our colleagues who live in rural areas, live in places with low transportation access, could their access to social work services be improved by an admittedly imperfect compact? And while we work to develop a national consensus around getting rid of the exam, or do we think that those access issues won't be fixed by the compact and that the compact serves zero purpose to helping any access issues? I think that for me is a question I've been trying to better hear from folks about. Do we think there are access issues that we could move the needle on even slightly with the compact, and then probably move more significantly once Maryland begins to move away from the exams to state level exam, or state level license rather?
Can I, real quick? Felicia. Scott, thank you for that, because I think that that is the tension intersection that a lot of us have been grappling with, right? I just passed my LCSW in December. I also was very harmed by the licensure process since I graduated in 2019. It is 2024. So I think when we are talking about accessibility, I do think that there is a level of accessibility that is going to happen should we pass the compact. And I also think that there's a level of accessibility that cannot happen if we do not let the work group do what they need to do so that we can have perhaps a more equitable compact process. Because right now, there are social workers of marginalized communities, myself included, who see folks in marginalized communities. And I counted how many times marginalized communities was brought up, but we did not have the racial diversity in that room. So I'm really curious about that as well. A lot of times when these conversations happen, Black and Brown, POC, and all of those intersections are left out of those rooms to discuss the actual accessibility issue. From my understanding, we have a national shortage of healthcare workers, including social workers. Last year, what they were saying was, well, social workers is going to be a booming business by 2025. Now with the social work compact, they're saying, oh, we don't have enough social workers. I wonder why we don't have enough social workers, because they're stuck in a licensure process that does not work. So it's a very tricky thing to say to me personally. Well, can we get a little bit of access? And then we have to think about who's receiving that access. And I think that those folks absolutely deserve that access. When I hear Dr. Judy Mountie's story, I can only imagine the amount of deaf and hard of hearing social workers, what they have to go through in order to have access. And that is why it makes it so complicated. But I'm also thinking of deaf and hard of hearing Black social workers who cannot have access because they cannot pass that exam. And BASL is a completely different language. And I know friends who are deaf and hard of hearing and do BASL, and I have served in practicums with them, and they have left the field because they cannot pass that test. So I think we have to be very honest to understand that how much is the compact going to increase access for most people? Outside of the exceptions, that is the smaller language groups, such as our deaf social workers. And then I think something else that, especially during Black History Month, that I wish we would stop doing is using marginalized communities as a token to get what we want when we want these bills passed. That's just my soapbox for tonight. I promise I'm done after this, I promise. Anyone else? Sorry, y'all. Just had to get that out. There are some questions because I know we are sending out, let me put myself on video. I just had to take, oh, Mike, please go first before I say what I'm gonna say.
Oh, I'm sorry. I think this will be
Do
my
not
last,
apologize. No, please go.
my last piece. Okay, because I'm glad you were going to get to some of the questions that I think are good questions. So I wouldn't take long. I just wanted to, thanks folks for the questions. Thank members of the work group. And as you were saying, Felicia and Scott and Dr. Mountie expressed, it's a kind of complicated issue, this compact thing. What I want to just ask folks on this group to do, and the people who watch this video, is I think the members of the General Assembly need to understand that it's complicated at the very least, and not see this as some sort of simple thing that's separate from the work that the work group is doing. So they can make their vote based on a kind of informed decision. I think we have the responsibility to inform them, because I think other people are not giving them the full picture like that you just presented, Felicia. So I want to encourage us to communicate with our representatives.
Thank you, Mike. Those who are in SWER, they're used to this. I realize that some people are very new to me. And I have what some of my colleagues call like deaconess moments. That was one. So thank you for bearing with me through that. I get very passionate. I think at this point, while SWER remains neutral, I think next steps, Ellen was asking about next steps. Other SWER members can hop in, or I think the recommended next steps are to take what you've learned here and make the most informed decision and write legislators about the concerns about the compact. I personally think that the compact undermines the work group. And as someone who's on the work group and puts her all into it, it feels like a slap in the face. I'll probably write that, and that's just me. But we encourage you with all the information that has been shared here to please contact legislators, contact senators, contact the HGO committee about what you're seeing. Scott has put, he really thinks the compact will pass. So should we think about what concessions we can pull from the process? You know, we've been through that already. So I think we should. And I don't know what that technically looks like, but I do agree with Mike that ultimately our job and what SWER has seen our job to be is to have these types of discussions so that everyone can think more, make more informed choices, go back to their organizations and say like, hey, maybe we haven't thought this all the way through. Maybe we haven't heard all the voices that need to be heard. I love social work so much, which is why I critique it so deeply. I really, especially when we do these things during Black History Month, it really gets on my skin. I really want us to think about, is our bias showing up? Is our prejudice showing up? Did I meet with every single person that's going to be impacted by this policy, by this piece of legislation? Because oftentimes that's not happening. When I watched that HGO testimony, the first thing I asked was, well, where's the Association of Black Social Workers? Because we're talking about marginalized communities and we don't have the representation from said marginalized communities that are social workers in that room. I'm not a part of the NASW anymore, so I'm actually a member of the Association of Black Social Workers now, for that very reason of when I do this work, I'm thinking of where are folks, where are Indigenous folks, where are deaf and hard of hearing social workers, where are they being asked how this is going to impact them and those communities that they serve? And oftentimes I don't know if they are. Y'all got to stop not inviting people to the table, because I know that this is going to be rewatched by legislators. Please stop not inviting people to the table, but then being performative during very culturally sensitive months to people and then saying you care because your actions show otherwise. That's not fair. And we do too much good work. Bobby is out here in these streets all the time. All the time. He has so much insight and wisdom to share. So I do want to share some other questions that have been brought up that I think is very important for people to consider and for people to know. And some of these we have kind of addressed, but one that I don't think, this one, how can the compact consider broader goals of removing barriers and creating equitable paths to the profession? I think we discussed that we don't necessarily know if it can. And there was one about licensure. and insurance, right? How will state Medicaid, Medicare, and private insurance companies participate in the Interstate Licensure Compact? I think that is very important. How does the compact plan to increase access to social services without addressing the nationwide shortage of social workers? Is there an assumption of underutilized social workers who could fill the gaps in service? This is a very important one. Considering Maryland's Board of Social Work is already short-staffed, what is the anticipated capacity and turnaround time for processing compact applications? And I think this is something that we've also asked. Oh, Mike, you can come off.
Yeah, I think that's a really important one to stop on, right? And that's another one that I think, even maybe to Scott's point about what we can highlight in this process is that it does create more administrative issues for the board that's already not, has struggled, to put it lightly, to kind of meet the demand that it currently has. And then if the work group recommends something later, and then we then have these kind of double licensure processes. This is an issue that I don't think is being considered really much at all. So I just wanted to highlight that question because it's a real one, and it impacts. If you're on the Facebook group in Maryland, you can see how many people are struggling to deal with just what's currently the current processes.
Absolutely. And you were putting it lightly. You were putting it lightly. Yeah. I think this speaks to what Scott was asking. Given the compact's language is set, where might there be room for amendments that address specific concerns? When we're talking about next steps, please highlight those concerns to see if there is a way that they can work with DOD and the council and the ASWB to find different language. I don't think that things happen unless they are highlighted and pushed. And I think we already saw in real time how powerful we can be. And so this is also an important one because we didn't know an answer to this. What is the timeline for the compact's implementation? Will Maryland sign on? And then, a lot of folks were asking us how to advocate for Maryland's participation. Again, we leave that up to you guys. If you want to advocate for Maryland's participation, please reach out to the senators. But I do think it's important for us to understand what the timeline is for the compact implementation, just so that people can be aware of how that's going to look. And yeah, how will the compact ensure that social workers from other states are knowledgeable about Maryland laws and vice versa? And there was a really important one regarding, and I think Rachel brought it up, and if she wants to speak to it, is it? Well, this one is for the NASW. And I don't know.
I can speak to that if you want.
Yeah. If you can speak to that, and then I'll do this NASW question. I think.
Sure.
Oh, this is yours.
Oh,
I
there
couldn't
it is.
find it. There it is.
So, one example I brought up was gay conversion therapy is outlawed, thank goodness, by law in the state of Maryland. But states like Florida have pending compact legislation. How are we ensuring that we keep gay conversion therapy out of our state? Also, you've got states like Florida, maybe even like Missouri, which has already passed, where social workers may be mandated reporters about minor children receiving trans affirming care. Are we okay with that? Are we okay with having to report something, personally, I could not do that. I would just not be able to work in those states. But, you know, there's some serious ethical concerns.
Thank you, Rachel. And then finally, why has the NASW changed its stance on the compact despite previous concerns regarding the ASWB exam? In 2023, NASW stated, and I quote, NASW is prepared to oppose the Social Work Interstate Compact legislation being developed by the Council of State Governments, also known as CSG, if the bill is not substantially improved, including the removal of provisions which codify the ASWB exam. Obviously, that did not happen.
I think I know the answer to this, though.
Okay, please answer.
There was some language change, so that the language that adds that that there's the possibility of a substitute assessment was added to basically appease the NASW there. It was, you know, from my standpoint, it was a very kind of weak addition that allowed the NASW to approve of the compact, which it wanted to do anyway. But it does provide some wiggle room to move away from the ASWB exam and consider alternative assessments down the road. So I think that's.
And so I think the down the road part is something to highlight. We don't know if down the road will happen. We don't know if down the road will, like, if we don't even know if we'll get to down the road. And I think that is some of us who are on the fence, it's our biggest concern. Like, what if we never make it to down the road? And I think for some of us, what we really would like of an organization that does have all that power and all that pull to have been a bit more concrete in having that language that would for sure make sure that we got down the road. So I think that's just me personally, because I think it just opens the door. But thank you, Mike, for clarifying that there was language change, albeit maybe weak language, but there was language change. So thank you for clarifying. Guys, we ended on time. Sorry, I hit my off button. We did time. That I'm very proud of us. We'll put in the chat, and I'm sorry I haven't been keeping up with the chat. Let me start here. Dr. McClellan said the compact might help unclog the backlog at BSWE. There are thousands of out-of-state social workers licensed in Maryland who have to go through the same process that in-state folks have to go through. If we had a compact, it is possible that we wouldn't get the hundreds of out-of-state applications, which are taking the time of the staff. Okay. And then we'll put, again, remember that the commission will be comprised of members of state boards who are members of the ASWB. I don't believe that option will ever be used. Yeah. So, and I'm scrolling up. Victoria, Bobby said, yeah, folks don't invite us to the table too much. That's unfortunate. That needs to change. Victoria, the system is designed to keep some people up, some people down, and some people out. And unfortunately, social work is still participating in that system. Does anyone want to come off mute? Thank you. Thank you guys for all the opportunity for discussion is what Dr. McClellan says. Sorry, Freudian. Does anyone want to come off mute and say any last thoughts before we thank everyone very, very much and tell y'all to please enjoy your evening? Dawn says she appreciates the space and sharing of your knowledge. Thank you. Thank you for being here.
I want to say thank you, Felicia, for leading us. And thank you, Dr. Mounty, for your perspective as well. as always.
Huge shout out to Dr. Mounty. She has taught us so many things. So thank you for speaking to the experience and often being the representative for the experience a lot of the time. Okay. If there's nothing else. Oh, Scott had a very sweet. He said, love social workers for caring this much about the profession and our clients. Ellen said, thank you for doing this. It's a pleasure. This is a passion of mine, if people can't tell. So it is my pleasure to ask people. And so I really do have to shout folks out, because when I said, y'all want to do a town hall in a week, nobody came after me or anything. They're just like, okay, what can we do to help? And that is literally the community that we have built with Swear. It takes a lot of work to do these. We are accessible for folks who often don't get to be in the rooms. And so we are asking for folks, if you are interested in putting into our donation pot so that we can make sure that we can have interpreters at every one of our events, please email us at hello@swear-md.org. That's our email, right, y'all? I think it is. Hold on, let me go to the last page. I'm sure it's on there. It's been a long day. Back-to-back clients, and then popping up here. Yes. If you would like to donate to the cost of tonight's ASL interpretation, please email us at hello@swear-md.org. You can follow us on Instagram at swear_md. We will get our website together. We're very busy social workers, and we just haven't gotten around to it. We're a grassroots movement. It takes some time. We really appreciate being in community with y'all. I am a community person. This brings me so much joy. I don't think all of us have really gotten together in some time. So this just makes me very happy and emotional, but it's also 9 and I'm tired and I had 8 clients today. So that could also be adding to it. We want to thank you so much for joining us. Again, if you're interested in donating to the cost of tonight's ASL interpretation, please email us. And I think we will be starting a donation page so that if we have to do this again, we can without having to think of the financial constraints, because this is really important to do for not just social work, but for the communities that we serve. If we advocate for ourselves, we can also show other people how to advocate for themselves. So yeah. Thank you guys. Have a great evening. Have a great night. Swear, if y'all want to stay on for last minute things, please feel free, but I'll be here until the last person signs off. And I don't know how to stop the recording, so